Now are going to get down and dirty and deal with real people dealing with real patients. And you have in front of you a formidable panel. The patient here is Cathy Pearson, and Cathy is a professional actor. And the role of having the patient here is to remind us constantly that we are talking about real people and to incorporate in all our discussions this morning the needs of the patient and make sure we're addressing those needs. So Cathy's here to keep us honest. Cathy Pearson has been seeing Simon and Louise in their general practice for some time. Cathy, can you tell us a bit about yourself, please?
Yes, my name's Catherine Pearson. Cathy, most of my friends call me. I'm 60 years young and I'm married to Robert, who is a litigation lawyer in the city. Basically, personal injury work he does. I have 4 daughters. My eldest daughter, who's 36, is married, lives in Melbourne, no children. Her name's Melanie. I have a 34-year-old daughter called Hayley, and she's actually teaching English in a school in Tokyo and has been there for 5 years. I miss her terribly, actually, but she's doing very well. My third daughter, Esme, is 30, and she's married to Gary and has 3 children, so I have 3 grandchildren. Lucy's 7. Charlie's 5, he's a devil, and Annie's 3. And my youngest daughter, Amy, who's 25, she'll be getting married next August. No fuss, she's marrying Terry, who is a fireman, and she just wants to be on a beach in Fiji, so saves us a bit of money, but it sounds very exciting and I'm looking forward to that. I've suffered from bronchitis for the last few winters. As you get older, I think you expect to do that. And I've had bronchitis this year, and as the flu and the winter that we've had this year, everybody's had this cough that hasn't gone, and my cough hasn't gone this time. I've had one course of antibiotics, obviously, for the bronchitis, which was quite a few weeks ago now, towards the end of the winter, but this cough is still hanging on, and I'm now getting a bit fed up with it, to be honest. Typical woman, you carry on. I work 3 days a week for the University of Sydney in their music library in Seymour Centre, Tuesdays, Wednesdays, Thursdays. I had, if you want a little bit more of my medical history, I had appendix out in my middle teens. I think I was about 14, 15. Other than that, I've been perfectly healthy. I do take a moduretic every day because I've had mild blood pressure for about 4 years, I think. Forgot about that because you just get used to taking something. I suppose my youngest daughter had eczema as a child, whether that's of any interest, I don't know, but she had that, but that seems to have cleared up. I do get itchy eyes now and then, but other than that, I'm quite healthy. So I've come to the GP to see if they can give me perhaps another course of antibiotics to get rid of this cough, which is now, getting in the way of life.
And what do you think is causing your cough? You say it's a history of bronchitis?
Well, yes. Everybody's had trouble getting rid of their cough this year. It could be a respiratory tract. I think my father, I can remember him being quite chesty. It might be as I'm getting older, I'm getting chestier, so these coughs are not sort of disappearing as quickly as they should.
Let's go to your GP, Simon. Tell us what sort of things run through a general practitioner's head when you're confronted with this very vague presentation.
Sure. And Cathy isn't my regular patient. She regularly sees Louise. So I'm going to pick up the notes and have a look and see what I need to know about Cathy. I have met her before over the years, but I don't know her history well. So I'm going to look and see what her family history are like, what medication she's on, what past history she's had. And then when I hear about a cough such as she's described, particularly one that she's had intermittently over a couple of winters and has already had a course of antibiotics for this year, I'm going to be thinking, well, a cough is a common symptom in general practice. It's one of the commonest presenting symptoms. So I'd be thinking, well, is this a respiratory cough? I know she's not a smoker, so the risk of something like lung cancer is going to be pretty low, very low. It could be associated with allergy. We have one of the highest, or if not the highest, incidence of hay fever in sort of eastern seaboard, New South Wales in the world, and allergy is often associated with cough. It could be something like reflux. Increasingly, We recognise that reflux can be a cause of cough in our patients. And I'm going to be thinking of, could it be any of those sorts of things, or some sort of atypical infection that's continuing.
And at this stage, what advice are you going to give Cathy?
I probably wouldn't be giving her advice until I talked to her about the cough and how much it bothered her and in what context she saw it. I'd be wanting to know whether she had any associated symptoms with it, like fever, whether she was getting short of breath with it, whether she'd had any other sort of systemic symptoms, like had she lost any weight or anything like that.
Cathy,
you've just heard the questions that Simon was going to ask. What's your answer to that?
I've lost about 4 kilos this year, which I'm really pleased about. You're always trying to lose weight, and when it sort of comes off, and it's probably because I'm moving about a bit quicker. The cough is annoying me because working in a library, they're not saying anything, but I know it's irritating the other people when you have to be fairly quiet, and I think it's subconscious. When you know you mustn't cough, you want to cough even more. Just trying to think of one of your other questions.
How are you feeling generally? Energy levels and things like that. Are you tired or are you feeling fit?
Well, I think we all get tired as we get older. I mean, yes, I feel tired, but then I feel 21 inside, but the mirror in my body tells me otherwise. So.
And have you done anything different this year that would have accounted for the weight loss? Have you been on a different diet or had a different exercise program?
No, I've seen the grandchildren more, so they keep you young, don't they? And you go down to the ballpark more with them and try and kick a ball about and try and be 21 when you've got them. So I've just assumed, I think, because my Esme, which is the mother of my grandchildren, she's gone back to work a few days a week, so it's on occasions I have the children. And 3 little ones, admittedly 2 of them are at school, but just taking them to school and picking them up again, it's exhausting. Absolutely. It's lovely to pass them back.
So having
much as I love them.
got the history and then done an examination, which would have included a respiratory examination and possibly some spirometry. We know there's no past history of asthma or anything like that, but recognising it can come on at any age. But assuming that the spirometry values were reasonable for Cathy's age, I then would be checking to see whether she's up to date with what would be standard screening things for a 60-year-old woman, so things like breast checks, mammograms, pap smears, because a whole lot of other things could rarely end up in symptoms that might include cough as well. If all of those things, if none of those things sort of triggered any particular alarm, then I'd be at the management stage where I'd be saying to Cathy, well, look, based on what I've found, Cathy, I can't really see any cause for your symptoms. You have had a couple of episodes of bronchitis in the last few years, and it may well be that it's there again. It worries me a bit that it hasn't responded to the other antibiotics. Yeah. We've got a couple of options. One would be to perhaps do a chest X-ray. Another might be to try a different antibiotic, because not all germs that cause chest infections respond to every antibiotic, and I note the one that Louise prescribed for you in late winter. We could try a different one.
Yes.
And I think if we did that, then saw you in a couple of weeks, if the cough hadn't settled, then we could take it from there.
Okay, so Cathy goes home with that advice. She comes back a month later, and the cough's still there, and you order a chest X-ray. And that shows slight overinflation, but otherwise normal. What next?
If the cough, what's the cough been like in the last month?
It's getting a bit painful to cough now. They're continuing coughing. I can feel it in my back, like a strain. It's getting difficult at work, really difficult now. I mean, they are sort of saying, shouldn't you go and have this seen till you've had it for a long while? So I thought I'd better come back, because the last lot of antibiotics you gave me doesn't appear to have worked.
Look, I've seen your patient, Cathy, a couple of times, and she seems to have a persistent cough. She's had a couple of different courses of antibiotic now. Management all seem quite reasonable, but she's not responding. So I think it's probably time that we did a few other investigations. I'm worried she may have some sort of inflammatory lung condition, so I'd like to do blood count and probably some inflammatory markers as well. Chest X-ray we didn't show anything.
But nothing else.
Not keen to give her more antibiotics at this stage, but I'm just a bit worried at her age that perhaps we should be looking for something else.
I think I've seen Cathy for a number of winters, and she has a tendency to develop this sort of post-viral cough. a couple of years ago she had, you know, an episode of what was probably influenza when I look back now. You know, she was tired and took a long time for the cough to settle. There's a bit of a family history of atopy in that she's got, I think, a daughter who had eczema, and there's a bit of hay fever and asthma in the family. And I've got to say I've been a bit concerned that maybe there's some hidden asthma going on. She works in a pretty dusty environment. She's recently moved to Sydney some years ago, but it's been since then that over the spring she's been developing this. So I actually was thinking whether or not we should be looking further. She's got a bit of hyperinflation on an X-ray,
Yeah.
whether we should be checking out the asthma side of things.
Yeah, no, I think that's reasonable.
Yeah. So at that point, I think I probably would organise a spirometry, which I'd have in the surgery. And I guess we need to know what that spirometry would show. Chances are it would probably be normal, I've got to say.